Welcome back. Dr. Manu Bhakta is with us today. Dr. Bhakta is with the Comprehensive Cancer and Blood Disorders Center at Children's Hospital, and he's here to talk about childhood cancer in recognition of September being Pediatric Cancer Awareness Month. The center is the region's only treatment facility. It's located in Chattanooga, and the tri-state region is also an affiliate with the Children's Oncology Group, a national research organization with access to the latest treatment options for children with cancer. Dr. Bhakta, thank you for being with us again. How has cancer in children changed over the years? Because you've been, studying this for about 25 years plus now?
That's right. I've been doing this for more than 25 years. I trained at St. Jude, and to kind of give you the bottom line, when I started my training, the cure rate was about 30%. Today, 80% of all childhood cancers are cured. By cured, we mean their children are intact, they are not left with disabilities, they grow up, are productive. 1 out of 750 adults in the United States today is a survivor of childhood cancer.
Goodness.
So the progress has been outstanding.
Yeah, it certainly has.
We continue to make progress. Progress in terms of cures, as well as after all the treatments, they are left with no significant residual problems. Do
children get some of the same cancers as adults?
Actually, there are big differences in the types of cancers that adults and children have. Adults tend to have more what we call epithelial cancers, like ductal organ systems, breast, colon, prostate, lung, and so forth. Children tend to have leukemias, lymphomas, brain tumors, certain developmental tissues like kidneys, nervous system, and so on. So the spectrum is different. The big difference is that kids are incredible in terms of what they can handle. They can handle a huge amount of treatment, some serious treatment they can tolerate, and their bodies are just so compliant and recover so well. That's one of the reasons why we can be so aggressive and have such great and outstanding results with children.
Are there any, the treatment methods pretty much the same for adults and children? You know,
we use very similar drugs. Yeah. That's true. The drugs used in children for their body size are much higher doses than we use for adults.
That's interesting.
You would think that children are being...
Would take less dose.
Would take less. It's so fragile and small. But they actually take a lot higher doses than adults do. But they are very similar drugs that are used in children as in adults.
Boy, that is interesting. Very interesting, to say the least. Are you seeing more cancers in children, or has detection improved a lot over the years? Right.
That's a great question, because we constantly think of this, and we are seeing more cancers in children. We used to, and I want you to recognize that we have an amazing academic children's hospital in Chattanooga, and it has evolved and grown to quite a facility over the last 25 years that I have been here. At the outset, we were a part of St. Jude affiliate, and we're now part of Children's Oncology Group, which St. Jude is as well, and we still network very closely together. In the early 90s, and I've been here for a very long time, in the early 90s, we had diagnosed 18 patients per year. Now there's approximately 50 patients per year. When we evaluate this, the actual incidence nationally has not gone up. But since our facilities have been enhanced and increased in its capabilities and resources, we have a much bigger drawing area. We draw from a much higher population than just around Chattanooga. And that's the reason why we're seeing a threefold increase in the children with cancer that are now coming to our center and receiving the comprehensive, the multidisciplinary type of care that we give. Now, there are some areas where it's beyond our capacities, and we will work very closely with our regional centers as well, to derive that type of need that they have.
That's good. Thank you very much. By the way, folks, we have some information for you. If you would like to know more, you can contact Dr. Bhakta through the 778 link number, or you can go on the website to erlanger.org/childrens. And that will get you some further information on childhood cancer. Thank you, sir.
Thank you.
Good to see you again. Now